be a presentation on methamphetamine abuse. To our varied members of the DHHS staff.
Great.
Go ahead.
Good morning, Chair Bone, members of the board. I'm Susan Buckley, Health and Human Services Public Health Director. I'm joined by Closer.
Yeah, please.
I'm joined by Dr. Asha George, Mental Health Director, and by Mike Goldsby, Senior Program Manager for Public Health. DHHS staff, at Supervisor Lovelace's request, Health and Human Services staff from Mental Health and Public Health collaborated to construct a report on methamphetamine. Senior Program Manager Mike Goldsby will take us through the report, and we'll be happy to answer any questions you may have following the report. Turn yourself on.
Methamphetamine, certainly a topic of a lot of interest recently, and I want to thank you. I appreciate the opportunity to talk about not only the chemicals, the drugs, but the impact that this has on our local community. And certainly I had the honor of serving as the County Alcohol and Drug Administrator in the mid-1980s. And while it was called crank and speed at the time, meth certainly was a significant problem at that point as well. So do have some PowerPoints, but I want to go through them quickly. I don't intend to read them and bore you, and have some time. And I do want to have some time for some discussion and questions. Meth is a stimulant drug. It's synthetic. It's all chemical. It basically heightens the fight or flight response. And I think that is a part of what is attractive to some people about the drug, a sense of excitement. That same turning on of all the systems, though, is what is so destructive about this particular drug as well. It speeds up the heart rate, the entire body, suppresses hunger, suppresses the desire or even the ability to sleep. And it's similar to cocaine, except that the duration is much longer, so that the effects of it last a significant amount of time. It is relatively cheap. It is unfortunately plentiful, and it can be smoked, ingested, snorted, or injected. There is no quality control in the production of methamphetamine, and so certainly the byproducts are often as destructive on the individuals that use it as the chemical itself. The long-term effects of meth...
Michael, for clarification, is there any quality control on illegal drugs?
No, you don't need a master's degree to deal drugs. Cumulative effects of sleep deprivation and malnutrition. Certainly, if there's been times when any of us have gone without sleep, we understand how impaired our ability to function is, but you start adding that up, and very destructive. The damage to all of the organs and systems, particularly the heart, the kidneys, blood vessels. The thought process, I think, is what terrifies a lot of people about this drug, and for some, the suspicion, paranoia, hallucinations, audio, visual, even tactile. It does, of course, damage the teeth. There is the loss of ability to function, and unfortunately for some, addiction. That term addiction we use as a clinical term, but it definitely carries with it all of the damage that occurs to the community and the families as well. Not everybody that takes this drug finds it desirable. I mean, many people try it a time or two and don't like what it does. Why do some people continue to abuse this drug that most of us know is destructive? I guess I want to go back to what are the underlying causal factors for both methamphetamine abuse, but also alcohol and other drugs. The biggest one is adverse childhood events, and I really paid attention in the first presentation you had today about the significance of that in our society. Trauma, incarcerated parents, and multi-generational issues are a huge contributor to this. Economic deprivation is another causal factor. Early use of alcohol and other drugs, and peer group or favorable attitudes. I meant to say contributing factors, not causal, because there certainly are people who are raised in poverty who do not go on to have drug or alcohol problems. I do believe people need to be held accountable for their actions, regardless of these underlying things, but it's just important that we all pay attention and understand that these are underlying factors. Addiction studies, I teach at College of the Redwoods as associate faculty. We live in a pretty neat time because there's starting to be more and more studies about addiction as a disease. And the understanding is that it's almost like people's go system gets turned on and it doesn't stop. So it's similar to other long-term diseases. I am very encouraged and have had the opportunity to meet a number of people in my career that have recovered from methamphetamine and from other drug abuse, but relapses do occur, and we need to have systems set up to accommodate that. Participation in self-help or 12-step groups is very key as well. This image is really pretty powerful, and this is our staff found this image, and we used it in conjunction with the Businesses Against Meth Abuse a couple of years ago. You may have seen it on the buses or a poster. In a presentation like this, we do wind up talking about chemicals, we do wind up talking about statistics, but I really want to have us remember it's real people, it's real families, devastated or, as that image shows, trapped by this particular drug. The background in Humboldt County of methamphetamine, in the 80s, places that had bikers had speed or meth, and certainly the 101 corridor was a place for that. Off and on, there have been clandestine lab production. This has been produced in our own neighborhoods, but that's not the current situation. Current situation is Mexican production in Mexico and distribution. You can see the map there that shows the distribution routes. Local labs and toxic dumps are very rare, and I validated this with some local law enforcement folks, including the environmental health and the drug task force. There've been this drug certainly gets people's attention, and there have been a number of meth-specific awareness initiatives in Humboldt County, and Bill Damiano's old enough to have been with me in almost every one of these. In the mid-1990s, it was very clear that we needed provider education, and a number of coalitions gathered to work on that. The Speed Prevention Awareness Network, SPAN 1 and SPAN 2, and Supervisor Jimmy Smith played a very key role in maintaining the energy that's required once something like this is brought to people's attention. The Life After Meth it's still a relevant documentary. It was produced locally by Keat TV, and following that, the Businesses Against Meth Abuse, and then currently we have the Humboldt Meth Abuse Awareness Program. In my opinion, every single one of these has done a very positive, has achieved some positive results by bringing attention, starting the conversation. There certainly are ongoing prevention, treatment, law enforcement activities that deal with methamphetamine throughout the years and in between all of these initiatives. And I just want to acknowledge that drawing attention to it is very important. An initiative like this does require a sustained effort, and want to just make sure that that is clear. The Drug Abuse Warning Network tracks across the United States admissions to emergency departments, and you can certainly see that poly drug abuse is a significant problem, meaning people taking more than one substance, and non-medical pharmaceuticals is definitely on the rise as well. Never forget about alcohol, never forget about tobacco, and you can see that nationwide meth certainly is having an impact. Those are the proportions. In Humboldt County, one of the measurements is how many people are on probation, and a little under a quarter of probation's local caseload are on meth-related convictions.
Mike,
yes.
on meth-related, does that include the burglary and the snatch and grabs that fuel the habit? This is going to be a bill. Or is that just meth possession, transportation, and sales?
This is specifically for health and safety code violations. Doesn't include property crimes or violent crimes, anything like that. It's only the health and safety code specific violations that they're convicted for.
Roughly, what's the percentage of you for people that are fueling the habit?
We don't have a case management system that's capable of breaking out people's primary drugs of use, so I really can't give you that data. It does play into other crimes, there's no doubt about that.
I also want to point out that it may be a smaller number of individuals, but the problem behaviors associated with the abuse and addiction of this sometimes are out of proportion to the numbers. The schools conduct the California Healthy Kids Survey. The last one that's available is 11 to 12, and there should be a more recent version that will be coming out later. This is available online. It has a lot of interesting information for people, but you can kind of see self-reported, never used. In the traditional public school system, alcohol, marijuana, and prescription drugs are much more often misused. But this is the traditional school system. These are people that are engaged. Prevention needs to be data-driven, and we all know what Benjamin Franklin said. Categories that are important in Department of Health and Human Services: universal prevention means messages to everybody regardless of risk. Selective prevention or selective treatment is for people who might be in a group that is at risk, but indicated is when there's an actual risk factor or exposure to the drug. You might be familiar to the old terms primary, secondary, and tertiary. These kind of roughly mean the same thing. Some examples of things that are done in public health: we try to focus on evidence-based practices, and certainly if we can delay experimentation or use of several different drugs, we'll simultaneously delay the use of methamphetamines. So it may not seem relevant to have a tobacco prevention activity mentioned, but it's important. Towards No Tobacco, our Project Alert, and our Question, Persuade, Refer. We have a number of community allies: Tobacco Education Network, Behavioral Health Board, Allies for Substance Abuse Prevention, and some youth development alternative activities related to leadership. Friday Night Live. Don't stare at this too long, but the primary in Humboldt County, we use a system called CalOhms, and this is to track the primary drug of abuse as indicated by the participants. And please remember that a number of people have problems with more than one substance at the same time. Alcohol is significant. You can see that methamphetamine has probably dipped slightly. You can see that heroin or the opiates are on the rise. And so this is the makeup of the people who are receiving treatment in Humboldt County for addiction. This is a snapshot of 2012, and you can see the California average, comparison counties, and then Humboldt County is green on the bottom.
Mike, could I ask you to go back to that previous slide? So I just want to make sure this is not showing the relative use of these drugs, but its prevalence among those that are seeking treatment. Right?
Yes, thank you for asking that question. There isn't a census question that says, do you currently use meth? And so the way we measure it is law enforcement, student self-reported, or admission, treatment admissions. And the belief is that these are probably an accurate indicator of the prevalence of the use of the drugs in the community. So yes, thanks for that question.
So, well, if it were, that would indicate that meth is far higher than marijuana in our community. And
it would indicate that people seeking treatment for meth is far higher than people seeking treatment for marijuana.
That's why I'm saying that if this were not to take this as an indicator of the relative prevalence of these drugs in the community at large, but just in terms of treatment.
Certainly. Right. A number of people, for instance, use alcohol with no problem, but others have significant problems with it. Yes. So you can see with the comparison counties in relationship to the percentages or the ratios of use. It's important that we mention our local treatment facilities, and particularly the county AOD outpatient, use evidence-based practices like motivational interviewing in order to engage and retain people in treatment. The matrix model is utilized locally. This is specifically focused on trying to assist methamphetamine abusers in staying in treatment. So there's some activities and some ways it's designed that will encourage that. And the county has integrated co-occurring disorder treatment. That's very important in this discussion related to people who have co-occurring substance abuse disorders and emotional disorders.
Supervisor Fennell.
Yeah, I notice in a lot of these charts that heroin and methamphetamine are pretty high. Do those usually co-occur, or are they separate tracks?
There is significant co-occurrence between those two substances, even though one is a stimulant and another is a depressant. Did that answer your question?
Yeah, no, that's exactly why I asked you, because they seem to be taken for the opposite reasons. So people get high and then want to come down, or vice versa. Is that why they would use two such diverse drugs?
There are people who use the depressant drugs like alcohol or opiates in order to temper or come down from the stimulant. But I think at the point that people are in the cloud of addiction, I don't think there's anything quite as specific as that clear of reasoning.
They just take a drug if it's available.
Recovery is possible with support, and what I enjoy about discussions like this is that it is an opportunity to kind of step out of the doom and gloom and really point out that there is, as the documentary said, life after meth. This is a copy of a print advertisement that we used a few years back with a family who wanted to be an example for others. There are a variety of community resources. This particular map has the facilities that are listed, but I want to make sure that you understand there are a variety of outpatient, there are counseling programs, private therapists. There are a number of people that deal with this in the community. The DHHS does provide partial funding to several of these programs: Social Model Detox, Alcohol and Drug Care Services, North Coast Substance Abuse Council, and there are some other programs as well, including clean and sober houses. So thank you for the opportunity. Thank you and the meth awareness people. Thanks for the opportunity to draw some attention to this. I don't think there are any simple answers. I think it requires collective impact. That's a variety of people working together with the same common goal. So no one person or program can deal with this. And open to questions or discussions. Was there anything you wanted to add? Thank you. We do have some resource lists that we'll make available to you. We'll put over by the counter. We'll be happy to share those lists of the different programs that are available in Humboldt County for treatment.
Supervisor Lovelace.
Well, I want to thank all of you for bringing this presentation, and there's some really good information and data in there. And first thing I'd like to just ask is if we can all get a copy of this and make it available to the public.
Certainly.
I think one of the big questions and concerns in the community is how do we square the perception that's out there of this? I don't think there's anyone that would not say that there's a perception that meth use is on the increase in our community. And I think that when we look at that one chart regarding treatment, given the far greater use of alcohol in the community, that the number of folks seeking treatment for methamphetamine is almost the same as those seeking treatment for alcoholism. And so it would suggest that it's far more, what's the word I'm looking for?
Prevalent.
Prevalent. Well, not more prevalent in numbers, but more, that we're seeing it higher. The impact of it is greater in the community. And so trying to go from there to figuring out what is the actual prevalence in the community at large beyond just those that are taking that step of seeking treatment. Would there be ways to get at that kind of data? We can track law enforcement can track where the meth is coming from, the number of meth labs that they're finding here, the trafficking that they're seeing into the area, and that's all helpful. But in terms of the actual number of folks that are using in the community, is there another way to get at that core data?
Well, we're happy to take suggestions and look at those kind of things. We do look at things related to unintentional overdose, and I guess I should say I don't want to minimize the impact methamphetamine has on our county by these numbers. That was not my intention at all, because it's a serious drug. We're happy to take recommendations, and I think looking further in the Healthy Kids survey might be a way for people to gain some more information. We're happy to look at some other ways.
Supervisor Fennell.
Well, two additional things I get out of this presentation, and it's really it's a huge problem as far as I'm concerned, and we have to call it out for what it is. I like knowing that you can actually recover, because it seems such a really, really difficult addiction for people, very, very difficult for them to get over. So it's really good to have that news that you can get over it, and that hopefully we can provide as much as possible resources to help you to do that. One of the things I've always thought of was very powerful are those images of what happened to people over a short period of time. And I think that should be in every school. No kid should escape that horrible image of what can happen to them, because I think when you're young, how you look is very important to you. And to think that you'll turn into something that looks so scary might be some kind of aversion, cause some sort of aversion. A subcommittee that I'm on that came out of the meth awareness has to deal with legislation. We're going to have a meeting very soon. Is there anything in your mind legislatively that could be done to address the issue?
I would defer.
Bill is there.
Go to the crime guy.
I have a little bit of a suggestion. I mean, in the year 2000, the voters passed SACPA, or Prop 36, which is compulsory treatment for people who are addicts. And the funding for that program went away. It was funded for 5 years under the legislation and continued by the state for another few years. And now we have still the mandate of treating addicts and not the funding to treat them. So for us, it was about $500,000, I believe, was consistently what the county got annually to support treatment efforts. And a lot of the statistics that Mike was sharing with you, people that are in treatment or entering treatment in Humboldt County predominantly are compelled to do so by the court. So, I mean, it's just something to keep in mind. I think that we offer a lot of supports in our criminal justice system for people that are trying to seek treatment and recovery, but you can't really compel people to have treatment, and you can't put them in jail because of the changes in the law. They take the money away, and then we lose an opportunity. And we hear that frustration from the courts. We hear it from all of our correctional partners, that we don't have the resources to actually treat everyone. That's not to say there isn't capacity here locally, but certainly having additional support through state legislation and restoring some of those funds that we used to receive would be helpful.
Thank you very much for that. Definitely bring it up. It is difficult, when you look and you say you can go back to the 80s when it was being created here, and now currently it's just being shipped here, but it's still here and it's still impacting our communities despite all of these programs. So I guess we've just got to step it up.
Supervisor Sunbrook.
Thank you, Chairбone. Yeah, I'm sure most of us all have family, friends who've been affected by methamphetamine. I haven't seen any drug or any substance that's been more devastating than methamphetamine. I've got childhood friends who went from productive citizens and great friends to people you don't know anymore, steal from you. It's really, really scary in a quick amount of time this happens. Got two childhood friends. One of them lives on the streets in San Francisco, and then another one who has gone through a year and a half of treatment and is actually running one of the homes that he went through, has his family back, has a job, and most of us thought we'd never see him again. And the real possibility for people to come out of it is there. It's like most of the time you think when you see people you don't know that are on it, they're just these tweakers until you know them, they're family or friends, and you know what they were before, and you have a lot more compassion for them. And one of the good examples here locally is Fred Lamberson from Teen Challenge. I don't know if you've ever seen his presentation before, but he's got a picture of himself when he went to prison. And you would not recognize him. He's got two black eyes, he's all skinny, it looks horrible. And he puts that picture up there to show people, most people wrote him off. And now he runs one of the most successful treatment centers here in Humboldt County. And it's, I've learned from him, you just don't give up on people. And it's very difficult to deal with because it feels hopeless. But I appreciate the awareness in the community now, and it seems like more people are getting fired up and wanting to do something about it. And I know from my part on the board, if there's anything we can do, just please ask.
Well, public comment?
Ken Sawatsky, as you said, we all have people. I have neighbors, other people like this. And you kind of look back and you try and say, so why did it happen? And why do all the dependencies happen? And our society is changing in many ways. It used to be, so many of us were rural. They were on farms. They worked very long, hard days, or they didn't eat. Our society now, unfortunately, is headed in a direction where our society basically, we feel for people, and I can understand that we all do for the people who can't take care of themselves. But then we may be enabling them in some ways because there is no fulfillment in being enabled. And as soon as the human being is not happy with who they are or what they are, or feel they have a purpose, like John Shelter gives these guys a purpose. They go out there and work, and he's pulling all kinds of people out there and getting them the jobs they need. If we ever do have a minimum wage, maybe we need to make an exception for that for all these people that we can get in that certain area and give them a purpose in life. Family no longer is what it used to be. The church no longer can fill the need. And so these certain groups that we have out here are taking care of it. But until society changes, in some ways, where people are able to get the jobs and able to feel accomplished and comfortable with themselves, I can't see things really getting that much better. The human being, whether it's alcohol or anything, has a tendency to sedate or move. My prime caregiver in Willow Creek, and I can kind of understand, we didn't talk about it too much, but he used to prescribe a lot of medical marijuana for all kinds of issues, and I can just see, do you have a choice between putting someone on that or putting them on meth? So it's a real difficult choice for our healthcare professionals and now he doesn't want to do it anymore because it was abused so much that he doesn't really take that option to use it as a form of a medicine. It'd be neat if we didn't need the medicines. A different alcohol. It'd be neat if we didn't need alcohol. Myself, I do. When I go home, I frequently have a glass or two of wine, and that helps me relax. It drives your blood pressure down. I've done some testing here. If you got to lower your blood pressure, you thin it down through whatever, but you slow down at the end of our very hectic days. Our society's changed, and I don't know how we can go back. We can't go back. Mother Nature may send us back. I keep warning about that. If she does what she does here, we may be having a different society, more of a survivalist society, more where we can feel accomplished just getting our food every day and providing our necessities. But without that, I'm open to suggestions in any way that any of us can help. I think we're all willing to participate. So thank you for the opportunity to speak on this issue today.
Morning, Bill.
Kennedy, retired citizen. Really appreciate the presentation this morning, very informative, have some background with it, some of the information. In any case, I'm just wondering specifically, how available is treatment? Hopefully we don't have any waiting lists for people trying to get those type of services. Hopefully these things are available to us. And then as an additional dynamic, what is the relationship between law enforcement and getting people into treatment? Are there steps, beyond conviction and recommendations? Are there any mandates to keep people in treatment, or is that their particular choice? So those are just a couple questions, and I thought I might kind of add to the discussion. Thank you very much.
Thanks, Bill. Hi.
Good morning, board members. I'm Diana Livingston, Executive Director of Crossroads North Coast Substance Abuse Council. Just to address the question of availability of treatment, we are licensed for 16 men and 6 women. Our women's house remains full because we have a HUD grant that ends in September for homeless women, and so we're able to keep that program very full. Today, there are 6 men in our 16-bed men's treatment program. Realignment has actually helped us tremendously because there has been more money that has flowed through probation. We also have a contract with County Mental Health, and that fills about 3 beds a month. Problems that I see that are really simple is, unfortunately, detox, unless a bed is funded through probation, someone on meth cannot go to detox now. And I understand the reason for that, but we cannot take someone into treatment who's high on meth. It destroys what's going on with the rest of the clients. A person who's suffering from that is very agitated. We don't know how they're going to behave. We have to watch them kind of every second, and we can't do it. So it would help a lot if someone on meth could go to detox, just go through that short period of time that it takes them to come down from it. The other problem just has to do with availability of funding. The other way that we are able to take a client into our program is if they're on SSI, but we can only have a few clients because that pays less than half of our cost of doing treatment. So just wanted to let you know that. Thank you.
I have a question, Dan. We have a question for you. Excuse me. Supervisor Sundberg.
Thank you. I'm just curious, how long does it take for someone to detox off of methamphetamine?
Well, to test clean, it takes them 3 days. But someone can come into treatment after 2 days. Behaviorally, they're okay after 2 days.
Thank you.
That was the same question I had.
Thank you.
Thanks.
Sister, I'm a registered nurse in California since 1977 and a recovering addict, member of the prevention group in the Meth Abuse Awareness Project. To concur with what Diana said, there are evidently 60 recovery beds in Humboldt County, and only 4 of those are paid for by the county. I really enjoyed my Goldsby's presentation, and it sounds as though there's all this help available. Unfortunately, it doesn't come down to the brass tacks of someone trying to get help. Often finds many closed doors and a lot of red tape to go through. There are a lot of solutions that we're looking at online and in meetings to try to address this and see if we can make it easier for people needing treatment to get to treatment, people needing information to get information. We want to use existing services and expand those to kind of include this need throughout the community. We have things like the Jefferson Project. The Jefferson Project has after-school programs. They have parenting classes. They're growing food. And how can we use that? My daughter is assistant manager of Youth Service Bureau's shelter, and they're desperately in need of funding. And the kids that come through there have these multiple familial issues of meth on meth generations, And the social problems are difficult. And I think it's important, I'm going to quote Dr. Michael Fratkin, that we take another look at our focus on the meth abuse problem. And to quote him as close as I can, he said, we need to shift our focus from a 20th century public safety / law enforcement paradigm of drug abuse to a 21st century public health approach to addictions of all kinds. We're people, and it happens in the best of families. When I was introduced to uppers and downers, it was through a Stanford buddy of my father's, an OBGYN my mother sent me to tell me about the facts of life. He started me on uppers and downers. By the time I was 18, I was in San Francisco shooting pharmaceutical meth. It was supposed to be a solution for heroin addiction, so all the jazz musicians I hung around were using pharmaceutical meth. I thank God that it was pharmaceutical. Maybe I'd have more teeth missing if it weren't. But it happens in the best families. In that doctor, there was significant abuse. They say something like 98% of addicts have a history of sexual abuse. I think we're not helped by the scare techniques. You couldn't have scared me, Estelle, with a picture of what I'd look like in 10 years, because I really didn't give a damn. And I had that attitude, I won't be alive in 65. Well, I'm 72 and I'm still here. And I think I've contributed a good deal to
Thank you.
community. I raised a good daughter, so
Thank you.
let me share.
Well, I'm hoping to scare people before they get started.
Richard Tolson. I had a good friend that got on methamphetamine. Then he started making methamphetamine down in Rodeo. Then he moved his lab over to Redding, and he got arrested again for making. And now he's in prison, and his family has disowned him, and I told his sister one time that I disowned him as a friend too, because he's serving 2 terms in prison for producing methamphetamines, and I really feel sorry for him because he's probably still addicted to methamphetamines.
Thank you, Richard. Bill?
I just wanted to correct the record. I know that the Meth Awareness Project has talked about the county only supporting 4 residential beds. It's not really accurate. The county alcohol and drug programs contract for, I believe, the equivalent of 4 beds. However, probation department through the drug court grant that we have and realignment money is spending another $400,000 on residential treatment beds, clean and sober housing, and detox. So there's actually substantially more than 4 beds that are being supported by county and or state dollars. So anyway, I thought that was important.
Supervisor Lopez?
Bill, if I could just ask, do you have a general figure of how that 400,000 translates into additional treatment? How many number of beds or?
I don't know how many beds specifically. I mean, the people that we're funding for 90-day cycles of treatment. The unfortunate thing about the realignment money in particular is that it's focused on a very small percentage of our population who are at the highest end. From a citizen's perspective, that's good because they're the people most likely, they're the highest risk to reoffend. But at the same time, prior to realignment, when we had treatment dollars, we would spend them on lower level offenders, people that weren't quite as far out there, people that didn't have this antisocial training by going to prison. We still have monies in our drug court program, and the Community Corrections Partnership Executive Committee has authorized use of AB 109 dollars, the realignment dollars, for our felony probation cases to keep them out of jail. So if we've got an addict that's currently sentenced and sitting in jail, we can release them from jail to make room for one of the truly serious violent offenders that we have and put them into a treatment bed. So we're augmenting the funding that's available for felons on probation.
Asha?
Good morning, members of the board. Dr. George, current County Drug and Alcohol Administrator from DHHS. I just wanted to respond to some of the questions that were asked. We have at this point 70 clients that we see every week at our outpatient alcohol and drug program. We have 16 outpatient groups that are being run. We have a program that is just for women who have both mental health and substance abuse problems. Healthy Moms, most of you have heard of that. In the past several years, we've tried experiments with working together with probation. SACPA was one of them when we had funding. The Micro Grant was another one when there was funding for that. And currently, AB 109, the criminal justice realignment, we are again working with probation to provide treatment for the folks who are coming, who have a criminal past and substance abuse and mental health sometimes. A good portion of folks who are now in jail, inmates, have a high percent of substance abuse and mental illness. So currently we have, through AB 109, 2 substance abuse counselors and a clinician that is located at the corrections facility and providing services there. So there is a large amount of service provision in our county. For example, right now we have no waiting list for our outpatient alcohol and drug programs. And I'm hoping that over time that our current residential providers will apply and certify themselves for drug Medi-Cal, which will actually help them with their funding and help bring some of the monies for that into the counties for treatment.
Great, thank you. Well, with that, and I know the charts show that, and I'm trying to wonder, Bill or Mike, how many on the treatment program? How many of those are court-appointed treatment programs that they have to come in? How many are voluntary? Do you have anything like a number like that? Both on alcohol and
most of the folks coming in for treatment are court-ordered for treatment. A very little portion of them are coming in voluntarily.
And I think by the recent meeting out at Redwood Acres, and it seems so cyclical, it gets to be a big part of our, Jimmy was a big part of that. We had so much going, and then it kind of sits. And I think one of the things that the difference between methamphetamine and alcohol is we don't have a lot of people out on their bicycles in the middle of the night breaking into our cars on their bicycles when they've been out drinking. It's the methamphetamine users that seem to be out, and that's where a lot of the crime is coming from, or seemingly comes from. And being on the drug highway, they don't want to stay off I-5. They're up and down 101. So we seem to be, every bust has a little bit of heroin, has a little bit of methamphetamine, and 10 pounds of pot. It just seems like every day one of the police reports, and it's frustrating for the regular citizens that don't understand it. And that's where we've hit. Redwood Acres hit a boiling point, and we need to. I know you guys are doing a great job, but we're getting to the point we just don't know. I don't know if it can get any better, and hopefully we're hoping for it to get better. And funding is huge. Funding's huge on everything. They keep taking money away, and they want us to do more with less. And we're trying to do what we can. But Bill,
well, I do think that things can get better, and I think that things have gotten better. I think Humboldt County is a great environment to show how community really makes the difference, and I agree completely with Mike in that I've participated for several rounds now of community awareness around methamphetamine, and every time we do that, we expand the resources within our community that can work on the prevention end of things as well as the treatment end. The reality is that the people that enter treatment predominantly are people that are forced there by the courts. The other reality that we have to deal with is since 2000, when the laws changed, you can't put addicts into jail. They aren't prioritized for jail beds, and realignment has changed that equation even more. That in fact, our limited jail beds really are holding our highest risk offenders and our most violent and serious offenders. And the nonviolent people, drug offenders, health and safety code violations, are the ones that get kicked out the quickest. Having leverage over people helps them stay into treatment. I know that there are disputes within the treatment community about it does forced treatment work. Well, obviously I work in corrections. I think it works pretty well. Our drug court program has hundreds of people that have graduated from the program, gone through all the different levels of treatment here in the community. 70 to 80% of our drug court participants have used meth, either as their primary drug or one of the cocktail of drugs that they mix together, and they can succeed. In fact, they tend to be even more successful than heroin addicts in treatment, at least in our program. So I think that there's a lot that we can do. There are limitations, obviously, in the system, and I think that a lot of what we heard at the recent meeting at Redwood Acres was about the annoying offenses, the low-level offenders, misdemeanor offenders, homeless people that have very complex social issues and support issues within the community. And I think it'll take the whole community to improve our response for those things. And I think we can do it. And I think this is a great opportunity to talk about it here at the meeting, educate people and encourage them to get involved. These are all our community members, whether they're your neighbor or they're a family member or whoever. It's going to take all of us to make the difference.
And Bill, thanks for mentioning drug court, because I've been to the last 4 graduations, and the people that are graduating, besides the excitement in their eyes and everything else, it's the people that come to support them that are who in the program are hoping to get to that point, and they see a light at the end of the tunnel. And the success rate, I've seen quite a few of those, and know quite a few of them when they're, and it is great. Drug court is a great successful program. I don't, judge Miles and that. It's just, it works.
Certainly, all of the people that provide treatment within our community really need to be applauded for their hard work. I mean, it's difficult working with people who have had their whole lives destroyed by addiction and dependence on substances. But thank you for your comments about drug court, and it's amazing. I mean, I love going to the graduations to see the families restored, the people's pride in their mother, father, brother, sister, nephew, whatever, and the babies that are being born to clean and sober parents, which is our future.
Thank you. We have a time set, or we?
I just wanted to say thanks again to the presenters and Bill for being here, and everyone in the community that's had an interest in this issue. Obviously, there's an interest that goes far beyond the limited amount of time we have to discuss here today. But I think the comments that we've heard in discussion make it clear that there is no model of who a likely meth user is. There are co-occurring things that that can lead to it, and we do need to address those. But this is a very complex issue. It's not going to be easy, but we do know that fear, shame, and punishment, the old model for dealing with these things, doesn't work. We're going to have to take a compassionate approach to dealing with this through prevention and treatment. And it's going to take the coordination from all the different parties: law enforcement, probation, public health, mental health, social services, and the community at large, the treatment community, everyone that's out there working on this very, very complex issue. And I just appreciate everyone for being here, and hopefully we'll keep seeing some slow progress on this complex issue.
Superintendent Fennell?
I just want to say one other component that I was curious about, and that is our recent designation as a high-intensity drug trafficking area. Will that provide any kind of help? Because I know we're talking about the current situation as basically being on the highway. Has there been any interface with that program yet from anybody besides the sheriff?
Not to my knowledge. I'll find out about it.
Director Crandall?
Department of Health and Human Services has no indications of additional funding for either mental health or alcohol and drugs coming to the county. We were realigned, I think 2 years ago, and that pretty much flatlined the state contributions to behavioral health, mental health, alcohol, and other drugs. And then remember, we had one opportunity where the board itself passed a resolution to retain public health realignment funds during the shift to the County Medical Services Program under the Affordable Care Act. And unfortunately, the state took several $1 million from the county, and the intent of our board at that time was to retain those funds to invest in prevention and behavioral health funding. So one hand doesn't necessarily know what the other does at the state level, and basically at the county level, we are capped and we're going to have to be creative, but there are no additional dollars coming.
Well, if there's any time to be creative, it's now. So thank you for doing that. Thank you guys for the presentation. I want to thank everybody that showed up at Redwood Acres to renew what was going on, and DHHS had a full staffing out there to take all that they were made very aware, so thank you.